Omega-3 fatty acids are believed to have potential benefits for reducing the risk of heart disease. They are commonly used in combination with a healthy diet and regular exercise to help lower triglyceride levels and increase HDL cholesterol levels. It's important to be aware that some supplement products may contain harmful impurities or additives, so it's recommended to consult with your pharmacist to ensure the safety of the brand you are using. However, it's essential to note that the U.S. Food and Drug Administration has not evaluated the safety or effectiveness of this product. It's always best to seek advice from your doctor or pharmacist for more information. As for the optimal timing and dosage, it's important to follow the instructions provided by your healthcare provider. To take this oral liquid, simply follow the instructions on the package label. If you have any questions, consult your doctor or pharmacist. If you're using the enteric-coated capsules, swallow them whole, and if it's the chewable form, make sure to chew thoroughly before swallowing. When using the liquid form, be sure to measure the dose accurately with a special measuring device or spoon. It's important not to use a household spoon as it may not provide the correct dose. Some brands may need to be shaken well before use. If your condition doesn't improve or worsens, or if you suspect a serious medical issue, seek medical help immediately. Omega-3 1220 Mg-Dha 330 Mg-Pa 670 Mg-Dpa 220 mg per 5 ml oral liquid has various benefits. The recommended daily dosage and optimal timing for taking this medication will depend on your specific health conditions and should be discussed with your healthcare provider. Some possible side effects of taking this oral liquid include a fishy aftertaste, nausea, bloating, or burping. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. Keep in mind that your doctor has recommended this product because they have determined that the benefits outweigh the potential risks. Many people who use this medication do not experience serious side effects. Be sure to contact your doctor immediately if you experience any serious side effects, such as easy bleeding or bruising. While allergic reactions to this drug are rare, seek medical help right away if you notice symptoms such as rash, itching, swelling, severe dizziness, or difficulty breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, be sure to reach out to your doctor or pharmacist. In the U.S., you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before starting omega-3 fatty acids, make sure to inform your healthcare provider if you have any allergies, especially to fish or peanuts/soy. If you are pregnant, only use this medication if it is absolutely necessary and discuss any potential risks with your doctor. It is unclear if this product passes into breast milk, so consult your doctor before breastfeeding. When taking omega-3 1220 Mg-Dha 330 Mg-Pa 670 Mg-Dpa 220 mg per 5 ml oral liquid, it's important to be aware of potential drug interactions. It's possible that this medication could affect how other medications work, or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's crucial to always seek your doctor's approval before starting, stopping, or changing the dosage of any medicines. This will help ensure your safety and well-being. If you suspect an overdose or experience serious symptoms such as passing out or trouble breathing, seek immediate medical attention. In the U.S., you can contact your local poison control center at 1-800-222-1222. Similarly, residents of Canada can reach out to a provincial poison control center. It is important to note that while taking this medication, you may be required to undergo lab and/or medical tests, such as cholesterol and liver function tests. It is important to keep all scheduled medical and lab appointments. Be sure to consult your doctor for further details. If you forget to take this product at your regular time, take it as soon as you remember. If it's close to your next dose, just skip the missed one. Don't take a double dose to make up for the missed one. Just take your next dose at the usual time. Make sure to check the storage information printed on the package. It's important to protect this product from light and moisture, so don't store it in the bathroom and avoid freezing it. Keep it out of reach of children and pets. When it comes to disposal, don't flush the medication down the toilet or pour it into a drain unless specifically instructed to do so. Properly discard the product and it's expired or no longer needed, and you can consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.